As the senior population continues to grow, so does the need for assistance, whether for oneself, a spouse, or a parent. The services of a home health agency may be the solution. However, before deciding on a home health agency, there are several questions to ask that will put your mind at ease that the agency you select is the right fit for you. Here to help us understand the importance of these questions is Carlette Howell, owner of Home Instead Senior Care in Pensacola. Carlette, thanks for being here.
Thank you.
Well, before we get into this, tell us a little bit about Home Instead.
Well, Home Instead, I started this company back 10 years ago now. And we serve all of Escambia and Santa Rosa counties. It's been a great business. You feel like you're really helping the community.
Mm-hmm. Well, and a lot of people out there are looking for help and looking at all the different agencies that are out there. You mentioned something important, though. You mentioned your length of time in business, and that's one of the things on our list of tips to share is knowing that information. So why is it important to ask an agency that you're exploring how long they've been in business?
Well, from my experience, that's what it boils down to is experience. Whenever you go to find an agency and you want to find out all the things that they can provide. And over the years, we've learned that having an extensive training for our caregivers has really prevented a lot of problems. That's not to say that we still don't have problems, because whenever you're dealing with people, you do. But if you can give them that training and those tools to go out there and take care of somebody correctly, it really does save a lot of things.
Well, you mentioned two things interesting there. One, training, which we'll get to in a minute, but also a variety of services. What type of licensing or registration is required for home health agencies, and does it vary depending on the actual type of services that they are providing?
It does. In the state of Florida, and each state is different, but in the state of Florida, we have to have, it's a homemaking and companion license, and that's through ACA, and you have to go through these different applications in order to become one. And then if you're going to do personal care, as I do, then you have to have a home health license, and there are certain criteria that you have to abide by with that. To have a home health license, you do have to have an outside office. Home companion, you can have an office out of your home. I've never chosen to do that. I think an outside office gives you much more credibility. Mm-hmm.
And you agree that that is one of the top questions that people should ask?
Absolutely, absolutely. It's so important to know that your agency really knows what they're doing and the different steps that they should go through. With our caregivers, we do by the state, we're required to do a testing of the drug testing we don't have to, but we choose to. There's a couple of other criteria where they have to be bonded. We have liability insurance, and then again, like I said, we do this extensive training program.
And you mentioned the bonding, so it would be important for someone to ask if the staff are bonded and insured and that type of thing, because they will be in their home.
Absolutely, and that is something that's extremely important. The liability insurance, if a caregiver, and workers' comp we also have, if a caregiver gets hurt, the client has no problem with liability or being sued. All of that's left on the agency.
So that's very important to make sure that the agency they're speaking with has that. Well, you mentioned drug screening, which is an option, but what about background screenings? There's just some folks out there that we might not want in our homes,
right,
unfortunately. So what about background screening and other type of skills verification?
Right. Well, when somebody comes into our office, before we ever send them to someone's home, we do the background screen, and we can do it right on the computer. It's done through FDLE, and that tells us right away if there's anything going on, and then we know if that person should not go out. It can keep you some sleepless nights if you send somebody out and you don't know what what their background is, because anybody, or I shouldn't say anybody, but a lot of people can come in and do great interviews, and then we'll do a criminal background check and find all these things. So you really need that paperwork, and that is required by the state.
Okay, so that's part of what you get from knowing that this agency is licensed or registered, whichever the case may be. Well, what about supervision of these people? Say, for example, I'm looking for someone to take care of one of my family members. One, I want to get to know that person, but I also want to know who is supervising them. What questions should we ask to find out that information?
Well, that's something that we just brought on board a couple of years ago, is a quality assurance person. And this person does go out to the home, knowing when our caregiver is going to be there, so that they can see what kind of situation and what's going on firsthand. We try to do it where they don't know we're going to make that visit, so we can actually see them in action and make sure that things are being done. We also make phone calls and ask our clients, you know, are you happy? Are you happy with your caregiver? A lot of the clients that we serve, they're not used to having somebody in their home, and so they don't want to call us a lot of times and tell us that maybe there's nothing wrong with that caregiver, but the personalities just don't match.
Right, and that's what I meant by that fit. You know.
And so they're like, well, we don't want this person to get fired, and we tell them, we go, well, you know what, they're probably not going to. We're just going to put them with somebody else. Just because your personalities didn't match, somebody else might. So that's how we gear that around.
Now, as far as feedback, industry-wide, is feedback typically given to the family on a regular basis? And if so, is this verbal feedback, or are there written reports that the family might get?
Well, we do both, and it really depends on the situation. If we see a change in the client, say one of our caregiver goes over and she calls and she says, Mrs. Smith, she just didn't seem herself today. She seemed a little unsteady. I think maybe we should make a phone call. Well, then we'll call the family and say, you know, maybe you need to check on your mom. The caregiver was a little concerned today.
Well, what should potential clients know about an agency's policy on handling grievances or complaints or concerns? Is that something that an agency should have in place as a policy for that?
Absolutely, and we do. We've got all kinds of paperwork that we give people whenever we sign them up. We have a service agreement that we sign with them whenever they start their services, and they have to. We go over all of that stuff with them and give them these different forms so that they have a packet right there that they can get to. But a lot of times they don't think of that whenever something does happen, so they'll call the office and, you know, either we'll put something in the mail, or if it is something that's really pretty crucial, then we'll go right over and take care of it.
Well, I know we're kind of just hitting the tip of the iceberg, but this is all great information, because people should feel comfortable asking questions when they are considering bringing someone into the home, and I think you've highlighted some of the topics that they should ask. But where could our viewers go to find more information, or if even in the situation of complaints? I think that's good to get out there as well.
Right. Well, you can always go onto the web, and of course we have a website. It's www.homeinstead.com, and that'll take you to wherever, like if you choose Pensacola, then it would give you the information on the Pensacola. And then there are other agencies around town that you can call, Council on Aging, that can give you referrals. If people that are out of the hospital, they usually get a list of people, of companies, legitimate companies that also are in the home care business. Okay,
and we'll be showing some information on the screen where they can get the website and phone number for ACA, which finds out about these different registrations. They have a toll-free number. So there's lots of information that can be requested or found out, and we just encourage everybody to do that. And thank you for being here to help us get these messages out.
Okay, thanks a lot,
we appreciate
Jeff.
it. Thank you.